If you're considering having a blepharoplasty, which is a cosmetic upper and lower eyelid surgery, I'm going to give you tips on how to recover from a blepharoplasty before and after the procedure. For those who are new to my channel, I'm Dr. Joel Kopelman. I've been doing eyelid surgery for the past 35 years, and I can give you the simple, straightforward instructions on how to achieve great results and recover quickly from blepharoplasty. Preparation is everything. Okay, so what we want to do first is to avoid things that cause any bleeding or elevation of your blood pressure. So we want to stop aspirin, Advil, Motrin, vitamin E, fish oil, omega-3. Anything that thins the blood will end up to prolong the recovery later because it's going to cause bleeding, inflammation, swelling. So preparation is everything. Right from the get-go, you've got to make sure you're not on any of those medications. The second thing is the blood pressure must be maintained at a normal level. If you have high blood pressure to begin with, we need to maintain a low blood pressure based upon medications you're already taking. So continue to take your medication as directed by your physician. If you are a smoker, you also have to discontinue smoking, if possible, within 2 weeks prior to surgery, because smoking also inhibits healing, and we want rapid healing following surgery. We don't want to have prolonged healing, which can lead to greater swelling and more inflammation and more infections. Some physicians, some surgeons recommend taking Arnicare or Bromelain prior to the surgery because they claim that this helps reduce swelling and inflammation following surgery. In my experience, I have not seen Arnicare or Bromelain improve the outcome of any patient. Every surgeon uses a slightly different cocktail to achieve a pain-free procedure and minimize bleeding during the procedure. I typically use lidocaine mixed with epinephrine, which constricts the blood vessels, mixed with tranexamic acid, which also limits the amount of bleeding that occurs. If you limit the amount of bleeding that occurs, it decreases the amount of swelling and inflammation following surgery. It also, by limiting the amount of bleeding, you use less cautery to close those little bleeding vessels, and that also leads to less inflammation following surgery. So things that happen during surgery can have a significant impact on the outcome and recovery that you may experience following the blepharoplasty. So following surgery, what I recommend is to use cold compresses on your eyelids for the first 2 days. Every 15 to 20 minutes while you're awake, you can apply cold compresses. The way I like to do it is I actually like to put gauze, wet the gauze, put it in a Ziploc bag and put it in the freezer because they're malleable and they can be applied to your eyelids and the shape of your eyelids. Some people use frozen peas and other things, but the point is use cold compresses for the first 48 hours because it's going to decrease swelling and inflammation. After the first 48 hours, however, you switch over to warm compresses because then if there's any bruising that's occurred, it will dilate the capillaries and actually absorb that bruise more quickly. In terms of exercise, I don't recommend that you do anything that raises your blood pressure significantly. So you can't do a very aerobic, heavy-duty workout. I do encourage you to walk and do maybe gentle exercise on a bike, but don't do anything that's really pushing the envelope because you can cause late bleeding to occur, and we don't want any late hemorrhages to occur. So use your common sense. Don't do too vigorous an exercise program after surgery for at least 2 weeks following surgery. After that, you can go back to your exercise program. I think it's safe at that point. Patients undergoing a blepharoplasty are always concerned of how much pain they're going to experience during the procedure. The procedure itself is painless. After surgery, you have mild discomfort. You don't have severe pain, and I almost never prescribe opiates or narcotics of any kind, because I find that it causes more nausea and potential vomiting, which can lead to bleeding and inflammation and swelling. So what I typically prescribe is before surgery, I give them a extra strength Tylenol, which is acetaminophen, and then after surgery, they continue with the Tylenol every 4 to 6 hours, and that is usually adequate in terms of pain and discomfort. And that only lasts usually for a day or two max. After that, we generally have no pain at all. Now, swelling also is a normal outcome of the surgery. The swelling, of course, can be related to the sutures that are put in the upper eyelid to close the wound. So after those sutures are removed, a lot of the swelling will dissipate because those sutures are actually cutting off some of the what's called lymphatic drainage from your eyelid area. You have to anticipate some swelling after surgery. The majority of the swelling will dissipate within 7 to 14 days following surgery, and you'll be back in your normal activities, whether social or professional, within 14 days of surgery. I don't expect any longer recovery than that. I've given you the best steps to recover quickly from a blepharoplasty. If you have any further questions, please leave them below. Subscribe to my channel, and I look forward to seeing you again in my next video.